We use one of the most cutting edge platforms for transcription for these episodes. And what we'll do is we'll drop the audio and video in, and it'll still come back with maybe 3% error rate, maybe even 2%. I mean, it's really good. I mean, from where I sit, we have to do very little to correct it, and everything that needs to be corrected is underlined because it's like, hey, we're making a guess at this word. They sort of highlight it, but still 2% in healthcare.
Yeah,
that's a big number.
yeah. Yeah, and that kind of a number is not going to fly. And so we're working with Nuance to set up a little like a demo room here on our floor. We've got an innovation lab where we can bring doctors through and let them experience that ambient kind of workflow firsthand, but then also provide, I think, good feedback to Nuance on ways that they can further reduce and fine tune their product so that number gets to zero and it just works.
Yeah.
It's not like theory when I try and talk to it and it's an argument at the end of it.
It's interesting. Somebody asked me about the acquisition yesterday. It was like, do you think this is good for healthcare? I'm like, I think it's great for healthcare. And the reason I think it's great for healthcare is because I think Nuance didn't have the cash to develop all the clinical vocabularies that they needed to develop. And they were just doing them one at a time. Well, I think they just got access to a very wealthy grandfather who might help them to develop that a little faster.
Yeah, totally agree. Like it's good for healthcare. Like it all works together in a weird way. I feel like I get a little more bang for my buck in our Microsoft EA renewal, and we write that huge check. Now that's just a tiny bit more palatable, not fully, but then it supports the Hello Epic as that functionality kind of comes out. So there is some nice interconnections there that will benefit the community.